moving on. So pathology of the skin. This one right here is going to be a relatively short one, because a little presentation here, because it's the end of integumentary. As soon as I'm done, we'll move on to bone, which is bone tissue, which is another presentation there. So first and foremost, right, pathology of the skin. Let me remind you what we talked about last time. It was all about the skin layers, the tissue, the cutaneous membrane, epidermis, dermis, hypodermis, the components, the cells, melanin, keratinocytes, melanocytes, and so on. Right? So we talked a lot about the details, if you will, of the integument. So now some of the most common aberrations to the integumentary system. For example, acne, right? This I had first-hand experience with when I was, back in my teenage years. So I had a lot of problems with acne, mostly because I had very oily skin in my face. So it wasn't until I learned how to manage, right, that oil, that problem, that I started to kind of alleviate the acne problem, right? Very common, right? Most people, I would say, are affected by acne at a point or another. So acne vulgaris, right, is the name that we give the disease, and it's basically caused by this oil buildup inside of our sebaceous glands. Okay, so we talked about sebaceous glands last time. We said that they produce and release oil on the skin, right, for protection, to help keep moisture inside of the body, right, and so on. So, but sometimes, right, and due to the presence of maybe too much testosterone, maybe too much estrogen, which could be the case, at different points, even as adults, right? At some points, throughout the days, we release more steroid than at other points, during the day. So those little bursts could cause, right, the accumulation of thicker oil, which could become sebum. That's one thing, or the accumulation of thicker oil due to the presence of maybe too much steroid. That's one, but then here's the causative agent, right? It's called Propionibacterium acnes. So this is the actual bacterium, right, that causes the formation of this pustule or a pimple, right? And by this point, this is already disorder right there, right? As soon as you have a little bit of an infection, which could worsen over time if nothing's done about it, then that's a disorder, and we call it pustules. Okay, so pustules are accumulations of sebum with the bacterium in it eating off of that sebum, and then the immune system trying to fight that off. All right, so the immune system trying to fight this bacteria off. So this would be manifested as white, spots that are visible on top of the pustule, right? So I'm sure everyone has seen that before. Now, there's problems if we start like poking at those. If we start rupturing the skin, because you're rupturing the epidermis and the dermis. If you pop those pimples, then that can cause scarring, right? Because sometimes, even though we regenerate the skin, well, sometimes we don't develop the necessary memory, so that the new epithelium can scar correctly, right? So that could be a problem in the long run. Alrighty, so that's acne right there. Again, very common nowadays. Now, the second type of pathology in skin actually has three subtypes. One is lacerations, which are cuts, superficial or deep. burns, right? First, second, third degree, and then skin cancers. We have different types of skin cancers. So lacerations, again, are cuts. They can either be superficial or they can be deeper. Superficial meaning only the epidermis, and deeper evidently going into the dermis and even into the hypodermis. So they are depending, right? Now burns, again, there's three types. There's first degree, second degree, third degree. First degree only affects the epidermis. Right, so these are superficial burns. Maybe you're cooking, and then by accident, right, you pass your finger over the flame, right? So you feel it, you jerk that hand away from the flame, right? It happens all the time. So not much other than erythema, which is a little bit of redness and maybe some inflammation, depending on the damage. But a second degree burn would involve the all the way down to the dermis. So here you would have for sure erythema, and you would also have inflammation. Right? So you would see inflammation on the injury site, if you will. Okay, so there's inflammation right there. Inflammation is characterized by a few symptoms, as you probably know. So one is redness. Two is essentially a bump, right, that you start developing on the site. And that bump contains not only blood, but it also contains extracellular fluid. It contains immune system cells, platelets, and whatnot to start to go ahead and heal, right? Start the healing process of that injury site. So again, second degree burns go all the way down to the dermis. Now, third degree burns go down further than the dermis. So go into the hypodermis and even into the deeper muscular tissue, and even into the deeper muscular tissue. So here you would have penetrated all of the layers of the epidermis, the two layers of the dermis, and then the hypodermis consisting of collagen tissue, ECM, fatty tissue, and perhaps even all the way down to the muscle, right? So evidently here, this is a big, big problem that needs to be dealt with by medical personnel. Right? So anyone with a third-degree burn is most likely going to end up in the emergency room, right? Because of the extensive damage here. Plus, that person is going to need antibiotics, right? They're going to need antibiotics. And a very specific type of injury site washing, if you will, to go and disinfect and remove any dead tissue that might cause further tissue degradation, if you will, which could be the case. Secondary second degree burns could end up in the hospital, right? But these are not necessarily burns that could damage the skin permanently, like third degree burns. So it's depending on on the person, the immune system of the person, and so on. Okay, so there's this rule of nines that divides up the body into 11 areas, right? Each one representing about 9% of the body, like the legs, for example, 9%, abdominal 9, thoracic 9, arms 9, right? So collectively, and then the head would be the other 9%, right there. So this is a useful tool in calculating how much the extent, if you will, of the burn on a patient. Okay, so now skin cancer. As mentioned, there's several types. There's basal cell carcinoma, squamous cell carcinoma, and there's metastatic cancer. Okay, so now, if you recall from biology, right? Biology taught you the cell cycle. I hope you recall, right? So the cell cycle. It's got 4 phases, right? But then the transition from one phase to another is characterized by a little checkpoint, brief checkpoint. That checkpoint makes sure that everything necessary to move on to the next phase is there, like growth factors for the cell, mitotic factors, right, that allow the cell to divide. Also, anything necessary for DNA replication, which is the second phase of the cell cycle. But then sometimes we lose, right? We lose control of one or a few of those checkpoints. So therefore, cell division is going to go unchecked. And the problem with that is that cells just grow and grow and grow like crazy, right, without any control, and they form masses, right? They form tumors. So they just start accumulating and accumulating, and again, they form tumors. So we have benign tumors, and there's also malignant tumors. I'll differentiate right now. So what can cause cancer? Well, cancer is mostly caused by mutations. So that's basically what causes cancer. Mutations are basically changes in genes. They can be small changes or larger chromosomal changes. So small little changes can go ahead and again throw the cell off in terms of cell division, and to the extent that these cells lose their own limit in terms of cell division. So there's many different types of cancer, right? But here's 3 of the most common types. We have basal cell carcinoma. That's one. So this is keratinocytes that start dividing uncontrolled, essentially, right? Keratinocytes. As we learned last week, keratinocytes are located in the lower layers of the epidermis, right? So they're the lower layers of the epidermis. As they become filled with keratin, they become the upper layers of the epidermis, which is basically what the skin is, right? So these cells are still alive at that point, right? In the lower layers. They become mutated and they start growing, uncontrolled. So ultimately, after months, they form these, if you will, craters, right? Which are known as carcinomas. And this particular type is basal cell carcinoma. Why basal? Well, because it's towards the deeper layers of the epidermis. I hope you recall we differentiated between basal and apical, right? So basal is the deeper side of a tissue. Apical is the superficial side of the tissue. Okay, so now this type of cancer, it doesn't metastasize, right? It doesn't metastasize, meaning that the cells stay adhered, if you will, to the tumor. Therefore, this can be removed, right, surgically. This can be removed surgically and treated for any remnants that might have stayed behind. The patient is probably going to get some sort of cocktail, if you will, in terms of chemotherapy, right, in order to treat anything that might have stayed behind. Here's the second type, squamous cell carcinoma. Right, so this is still keratinocytes, but then the layer is different. This is the stratum spinosum layer. So not as deep as the stratum basal, which was where the basal cell carcinoma arises from. Now this one here is more dangerous because it can metastasize. All right, so this one can metastasize. So it'll go and show up as an ulcer, right? That ruptures through the top layers of the skin. And again, these cells, they lose their adherence abilities, right? They lose their glycoproteins, so they don't stay necessarily attached, right, in place. So the problem is that they start migrating to other areas, right? They start migrating to other areas in the body. And at that point, they become metastatic, therefore malignant, because they start causing, cancers in other places. Let me show this little animation here real quick. Oh, goodness. Now, you're going to have a little bit of a hard time hearing, guys. Right? It's just because I don't have a, speaker here. But the what's called the closed captioning is there, and then you're gonna have access to it in the recording. Most cancer deaths are caused by metastatic cancer. Metastasis occurs when cancer cells break off from the original tumor, which is also called the primary tumor, travel through the body, and begin to grow in other tissues and organs. Metastasis causes death by damaging important organs, such as the brain, lungs, and liver. Cancer cells continually break off from the primary tumor. Some of these cells may move into nearby blood vessels and lymph vessels. Cancer cells can travel along these vessel highways to other parts of the body. Many cancer cells die while traveling through the blood and lymph vessels, but some may survive and stick to the vessel wall, then move through the wall into another body tissue. These cells may then divide and form a metastatic tumor. Where are cancer cells most likely to spread? Cancer cells tend to spread to certain places in the body depending on the site where the tumor first formed. For example, breast cancer tends to spread to the bones, lungs, liver, and brain. And colon cancer tends to spread to the lungs and liver. It's important to remember that a metastatic tumor is the same type of cancer as the primary tumor. In this example, colon cancer cells have traveled through blood vessels and formed metastatic tumors in the liver. These metastatic tumors are colon cancer, not liver cancer. Metastatic colon cancer is usually treated with drugs and other therapies used to treat colon cancer. Researchers at the National Cancer Institute and other research organizations are studying metastasis and ways to prevent it. Preventing metastasis will help prevent many cancer deaths. Of cancerous cells. So another name for them is essentially malignant melanoma, right? So yes, those newer tumors that are that might be in organs, they can be removed for sure. They can be removed surgically, but the thing is, there's remnants, right, in the body, so the patient's gonna have to be treated continually for months, even years, right, after the removal, to make sure that no other metastatic cell is left in the body, right? So there's this ABCDE rule for determining the presence of a malignant melanoma on the skin. First is A, right? So asymmetrical shape. Is it asymmetrical? Second is B, border irregularity, right? So it's not necessarily round, right? It has irregular edges. C is color, so blue, black, or maybe it differs in color, right? Or maybe over time it becomes darker, right? D is diameter. Does it grow, right? Larger than 6 millimeters, and is it getting bigger? E is evolving. Is it changing in shape? Is it getting bigger, as mentioned already? Here's more or less how this is used. A stands for asymmetry. If you draw a line through the middle of this benign mole shown here, the two sides will match, meaning it is symmetrical. If you draw a line through this mole shown here, the two halves will not match, meaning it is asymmetrical, a warning sign for melanoma. B stands for border irregularity. It